Hello and welcome to Kicking It with Kat. This is a space where you're celebrated, empower, and support all things women, from career advice and self-care tips to real walk about life challenges and successes. This is your community for inspiration, connection, and growth. Whether you're navigating your finances, the real estate world, juggling work life balance, or just looking for a place to kick back and chat, you're in the right place. Let's build each other up and share our stories and keep kicking it together. What I'd like for you to do is hit the like button, share, because someone else may need to hear what we'll be talking about. So, time to build the community, and the goal is to help us help each other. So, this segment is going to be about October is Cancer Awareness Month. So, what are the 5 tips that can help prevent early detection and prevention of cancer awareness, right? So the most important thing, number one, is screening. You know, why screening matters. The emphasis on many of the cancers are more treatable when detected early. And screening can be a life-saving by catching diseases before the symptoms appears. We are encouraged, having routine checkups. It is so important that you understand what's going on with you so that you're able to make sound decisions when things come up. But if you catch it early, then that's more better for the doctors to be able to give you a better treatment than finding it at a later stage, right? There are 2 types of screenings based on age and gender. For women, you have breast cancer. For women over 40, should discuss mammograms with their doctors, while those with family history or breast cancer may be to start early. I know for myself, I was in my late 20s, and I just so happened to be watching a program on how to check your breast, and I found a lump. And so if it was not for me doing this screening and testing myself, no matter what could happen, right? But we did the testing, and it was, benign. So they took it out. So, but ever since then, because I was so young, I have to have mammograms every year. So that's why it's so important, even though they say 40, I feel that because with me, with the early detection and checking myself, that you should always, just check to make sure, because you never know. But typically it is 40 when you should discuss that. Then the other is cervical cancer. Pap smears are generally recommended every 3 to 5 years for women aged 21 to 65. And the HPV testing is also helpful. Now, also bone health. After menopause, screening for osteoporosis, which is not cancerous but crucial for overall health, are encouraged. And treatments like chemotherapy can increase bone loss. So we want to make sure that we check ourselves. Now, even though I said 2, because they were talking about, men and women, and we are, of course, a women group, but hey, you have significant others, you have brothers, cousins, friends. So we want to make sure that we can talk about them too, because if we can help them as well as help ourselves, what are we doing helping our community? So for men, they're talking about prostate cancer. For men 50 and above, for early high risk groups, should consider the PSA testing and for prostate cancer, and then testicular cancer as well. This mainly affects younger men, so self-exams and discussing with healthcare providers are essential. And for everyone, you have colon cancer, typically starts at the age of 45. But early detection, with family history, including, options of colonoscopies and other invasive tests, because you never know. So I feel that anytime that you're feeling some kind of way about your body, that you need to be tested. Skin cancer. Annual skin cancer checks by dermatologists are important, especially for those with fair skin and a history of sun exposure. I was going to say that, the sun, and make sure that you always put sunscreening on your scalp, because those for lighter skin can cause skin cancer. Because I'm a dark pigmentate person, I had on my foot a little scar, and it started like a mole, and just started to get bigger and bigger, and I happened to go to dermatology, and it was skin cancer, so they had to cut it off. So even though I'm dark pigmented, I don't know how that came about. For me, I don't know all of my family history, because my mother was adopted. So but it's important to know, what your family history is about. Then you have lung cancer, right? For heavy smokers, 50 to 80, low dose CT scans are recommended annually to catch lung cancer early. I think that is important that, for those who are smokers, to really get it checked and to make sure that you are okay. Okay. Number 3 is knowing your family history. What I just mentioned before, if you can talk to your family and know what your family history are. Sometimes, like for myself, it's a put together family, so we don't know what our true family history is. So that's, a crucial part in understanding what are your risk factors as a family. So encourage your family members to talk about your history. What did your previous grandmother, grandfather, aunties, uncles, what did they pass from? Or what kind of health issues do they have? I know for my daughter, because her genetics are a little different, she always says, mommy, you and dad gave me your bad genes, right? And so that is what's so important. I know I had a cousin that called me because of our history, to know what was going on my side with my mom, because after years of her having a massive heart attack at 45, the family finally got together. But there were health issues that we do know now that we didn't know before. So also take a look at, genetic counseling. If there's a strong family history of certain cancers, breast cancer, ovarian cancer, cholesterol, then you need to speak to a counselor on it and a doctor to see how you can go about changing or preventing less risk of because of your family history. Of course, as I stated before, with the doctors and your family, is to talk about how to reduce the risk because of your family history, right? Also, number 4 is lifestyle choices that reduce cancer history. Diet is one of them. I think that what we are eating or what are being putting in our food is so important, that we pay attention to what we eat, how we eat. So, certain things that we are rich in that we should take in consideration of taking are fruits, vegetable, lean proteins, whole grains. These benefits reduce the sugars and processed foods of meat. So, pay attention to what you're eating and how you're eating. Exercise. Exercising regularly helps maintain a healthy weight, which then is linked to lower risk of many cancers. Okay, avoid tobacco smoking. Smoking, of course, is the leading cause of many cancers. So quit smoking as possible. Smoking is one of the hardest things that you can do. To break that habit, so find alternatives out there that can help you to stop smoking. limit your alcohol intake. Alcohol has been linked to several types of cancer, so moderate consumption is recommended. You know, talked about earlier, sun protection. Sunscreening is also recommended to use, especially if you're out in the sun, or protective clothing to, to avoid tanning um, beds to reduce the risk of cancer. Number five is the importance of regular check ins with your healthcare provider. We pay for all of our medical, right? Why not utilize it? I know a lot of people who do not believe in checkups. Why? Right? So I encourage that you have maintained your regular visits, stay proactive about your health, no matter what your body best. So remind yourself, to do regular checkups, to do for women and for men, to do those annual self checks, so that you can detect, because only you know what your body is like. And if anything feels off, or if you're checking, or you feel a lump, or you just feel uncomfortable in certain areas, then it's important to have it checked out. So this is my takeaway in regards to Cancer and Wellness Awareness Month, is to be proactive in regards to finding and detecting anything that's unusual that can cause cancer. So please hit the like button, share, because other people may need to hear this as well. And this is Kicking Your Cat, the community where we're trying to be informative and help each other to have a better life. Have a great one. Talk to you guys soon. Bye.